try this. So put your finger on, put them on all three of these. Right there. Okay, good. And then take it out. Okay. So, okay, look at this. That is the effects of radiation on your body. You really don't want to put cell phones on your body. Oh, that did make a difference. A little bit better, not much. Radiation kind of circulating through your body. Now we're going to see if this does anything to release. Yes? Yes. So this is Dave's bread, whole wheat. Okay? You can check yourself. If this hurts when you dig your fingers under your rib cage, you're low in stomach acid. If it hurts when you dig under here, you need a digestive enzyme. Can you ask your doctor to order some more tests for you?
I will.
Yeah, tell him you'd like to know. I'm gonna check you, but I'm gonna do the zinc test again. I'll show you with that.
And yes, Catholics do insurance. Okay. And did you get your dose chart? Your dose sheet of when you take that?
Yeah, I have.
Okay.
I've had objections for years. You know, I always thought it was hocus pocus. So far, she has cleared me off about 4 different medications. For about 6 months now, I've been off of them. I've been cleared off of the medication I've been taking for 10, 15 years.
Hi, my name is Valerie Ozsu, and I have my master's in nursing. I have been in the healthcare industry for over 35 years. In the last 20 years, I've been practicing as a nurse practitioner, nurse midwife, and I progressed to a point in my career that I found that my clients coming to me were not satisfied with their health care. How would I describe my work? What I do is I have an extensive interview with the client, and I want to know what what food toxins are affecting them, what are the emotional blocks that they may be having, and what are the potential causes. I ask a lot of questions, and I have equipment that I use in order to further evaluate the person to determine what is the cause of their problem and what they need to do to reverse it. In addition to asking questions, I also want the person to feel comfortable so that I can get to know them and I can coach them on what they need to do and do it from their level and from where they're standing at. After the initial interview, I've already incorporated their previous lab work and radiology reports. I check their blood pressure, temperature, oxygen level, their BMI, and I also evaluate their nervous system using a Nerve Express. From there, I move into further evaluation using nutrition response testing because the nervous system affects the organs and the organs are affected by the nerves. Nutrition response testing evaluates the body's organs and nervous system. As in Chinese medicine, in the Asian culture, the meridians flow, the body's energy flows and is continually flowing. If there's any break or block in that energy flow, that is when illness, disease starts to develop. In 2007, I opened my wellness practice, and in addition to my previous nurse practitioner medical training, I incorporated and took advanced courses in kinesiology, nutrition response testing. I became a certified ProEFT practitioner, Biokinetics, Gerson, and GAPS nutrition trainer. All of this work helps me to identify the primary organ that is challenged, and I use organic whole food supplements and homeopathics to determine what the person needs to reverse their health condition. And what I do is I create a plan, I write up a report, a detailed report outlining the steps that the person needs to take in order to improve their health and to heal themselves. If this sounds interesting to you and you'd like to find out ways in which you can better help yourself to improve your health or the health of your child or another family member, then give me a call and let's see if Natural Health and Wellness Center is a good fit for you.
By the time I went into the hospital for my stem cell transplant in January 2013 for Home syndrome, which was a type of blood cancer, I'd already been seeing Valerie for about 6 months, and I'd been working with her all that time to detoxify my body, change my eating habits, and really get myself into a much better state of health than I had been in for many, many years. I truly believe that that work laid the foundation for my smooth recovery, because I didn't have any of the side effects that they expected or any of the subsequent infections that are very common with stem cell transplant treatment. And really, it went as smooth as it could go, much to my doctor's surprise. And here I am 18 months later and with a clean bill of health from my doctors.
I have been now working with her for almost 2 years, and she helped me through this last pregnancy with my son. And at the age of 41, I had the most amazing, energetic, stress-free, complication-free pregnancy that I'd had. And I really just can't thank her enough for working with me during these last 2 years.
My wife was always red. We didn't know why. She had allergies. She was always scratching here and scratching there. Went to different kinds of doctors and allergy type of testing. She was down to the point where she couldn't even eat food or drink. Everything she was allergic to. Lots of lotions. One day she met Valerie at an event that I was at, and she came to see her, and I don't know how long we were here, 3-4 months.
I called her up because I was just so fed up with the medical system that I thought there's got to be another way. So I called Valerie up. It was like on a Tuesday night at 6:30 at night, and she said, "Come on in right now." And I started seeing her immediately, and within 3 months, she totally helped me and cleared up my allergies, and it was amazing. I could not believe watching my skin heal from the inside out.
Valerie's medical background has been really helpful, and I'm finding it really, really important because it turns out that I do have a lung issue, and so I have a pulmonologist, and so she understands how to best work with him. Also, the fact that she knows how to utilize tests, medical tests, to see the quality of our health, so that if I'm low in vitamin D, and I was, she knows how low, and she can read those things. And the same thing with the iodine test that she has us do, and these are all simple things. So that has been, like I said, for me, just such an important thing to feel like I'm getting the best of both worlds.